in December, so they're both joining her. So we're very excited to have Sara back working with us and working in the community, and she's going to share with you some of the work that she's doing around opioid overdose prevention and a lot of the information that's happening in the opioid crisis right now. So I will turn it over to Sara.
Thanks, Matt. Hi, everyone. I'm going to do a screen share, so give me a second while I pull this up. Okay, so I'm going to run through a presentation as I speak with you all, and just because of how things are set up on Zoom, I can only see a few of you. Feel free to interrupt if you have questions. I'll also stop periodically to ask if we have any questions. So I'm excited to speak with you all today about the Healing Community Study. So this was funding that we received, or really the project started here in Cortland County this past spring. And the whole focus is on working to reduce opioid-related overdose deaths in our community, and it's part of this larger initiative to address this issue nationwide. So here's the team. So Matt introduced us all, and they'll be able to chime in later on. So the Healing Community Study, it's this federal initiative. And it's looking to investigate how tools for preventing and treating opioid misuse, opioid use disorder, and overdose are most effective at the local level. So it's taking what we know to be true through research, taking evidence-based practices, and really working with local communities to find solutions. And the overall goal of this initiative is to reduce opioid-related overdose deaths by 40% during this 3-year grant period. To give you an idea, so yes, to reduce fatal overdose deaths, but also looking to reduce non-fatal overdose deaths, increase access to naloxone, which is the life-saving medication that brings someone out of an overdose, increasing access to medication for opioid use disorder, which is we're starting to realize is really an important part of helping people with opioid use disorder. And sadly, there's still not easy access to these medications, increasing the number of people that are accessing drug treatment, and identifying people early on so that their addiction doesn't progress. So as I said, it's part of this large initiative. So Cortland County is one of 67 communities across 4 states. And you know, we were chosen because they chose a mix of rural and urban communities, really a good mix of communities that represent the rest of the country. And the idea is what's learned in these 67 communities, these lessons learned will be taken to hopefully help address the opioid epidemic across the nation. So the 4 states are Kentucky, New York, Ohio, and Massachusetts. Here in New York State, there's 16 communities that were chosen to participate. Again, a mix of rural and urban. And the 16 communities were split into 2 separate waves. Because again, this is a research study. So in some ways, the second wave communities, which include Cortland, are being used as kind of a control. So wave 1 communities have already started implementing this grant. In New York State, we're working very closely with Columbia University. There's this massive team of experts that are working with the communities to implement different strategies. So close by, we have Cayuga County, which is already in the implementation phase. Cortland County doesn't start full implementation of the grant until January 2022. So we have a year where we were given funding to hire some staff, but really what we're doing in our community is kind of supporting the status quo. We're enhancing the work that's already happening in the community, and we have to wait a year before we get that like hands-on technical assistance from Columbia University, full funding, and so on. The 3 areas of focus for this project are around safer prescribing. So really ensuring that when people are prescribed opioids, that it's, you know, for something that really merits an opioid or at the right dose for the, you know, length of time. So really working with prescribers to limit access to opioids. And that's actually continuing work that Cortland Area Community Sick Care had actually been doing for quite some time. Previously, CACTC had the Partnership for for Success grant through the state, and had already started doing a lot, working with the hospital, working with different local providers to do a lot of work around this issue and a lot of awareness building. I'm sure some of you, or hopefully many of you, have seen a lot of the outreach and awareness that has happened in Portland County over the past few years to really raise awareness of the dangers of opioids, especially for young people when they access them at home, for example. So we're really excited to be able to continue that work and allow for that continuity. We'll also be doing work around, like I said before, increasing access to medications and other types of treatment for opioid use disorder. And then naloxone, because again, that is the medication that prevents someone from dying. And so anything that we can do to prevent death is obviously extremely important. And this project is really working with so many partners across the community. So we're working with the hospital, healthcare providers, treatment providers, our local public health department, behavioral health, and then criminal justice system, drug courts, probation, the jail, law enforcement. So working, really bringing partners across the community to work together on these really ambitious goals. So before I get more into what we're actually working on right now, I wanted to just stop and kind of give a brief overview about what we're seeing when we talk about opioid overdoses nationally, but then also locally. So in terms of the rise of opioid overdose deaths, we often talk about them in terms of three waves. So wave one was in the late 90s, early 2000s with prescription drug or prescription opioid overdose deaths. And now looking back, we know that that was because folks had pretty easy access to prescription drugs. Then over time, changes happened, right? We became aware of this. Prescription drug monitoring programs and other things that actually limited access to prescription drugs. But then what did we see? This rise in heroin, especially around 2010. And then the third wave was this rise in synthetic opioids, especially fentanyl now. And so this trend that we saw nationally, we also are seeing in our own communities. So this is comparing Portland County to the rest of New York State, excluding New York City. So this is for all opioid overdose deaths. So we're seeing, starting in 2014, kind of this trend upwards, with this peak in 2017 for us, especially in Portland County. It was definitely this little spike. Then a dip down, and 2019 kind of going back up again. And all anecdotal, and preliminary information that we have does show that 2020, we definitely will be seeing this increase in deaths again. When you look at specifically heroin, so the blue and orange lines are heroin, follows a similar trend, spike in 2017, but kind of this downward trend. And we've added here, the green line is fentanyl. So any overdose death where fentanyl was present. And so even though we're seeing this decline in heroin, what we are seeing is more and more deaths, there's fentanyl present in the individual's body, which again is following, national trends. This was a Portland Standard article from October where, the coroner and city police were talking about this doubling in overdose deaths this year from last year. So again, all preliminary information is showing that there definitely has been an increase in both fatal and non-fatal overdose deaths, and that fentanyl is a big part of that. And when you look at the median age of an individual who's overdosed, it's 33 years old, and it tends to see more male than females overdosing. And this is data that we collected from the city police. They're now reporting all of their overdoses to us. So that just gives you kind of a quick little picture of what we're seeing in terms of overdoses and especially overdose death. And then 2020, and especially with COVID, what we're seeing, sadly, is all of this seems to be getting worse. So when we're talking about substance use, addiction, mental health, it's COVID and what is happening in our country, sadly, is making things a lot tougher for folks. So we're seeing an increase in alcohol sales, an increase in underage drinking, increase in mental health, suicidal ideation, substance use disorder symptoms. And again, anecdotally, we're seeing definitely this increase in overdose. It's going to be probably a while until we know exactly all of what this looks like in terms of what COVID has done. It takes a while. Sadly, there's a lag in data before we really know the true cost of everything. But I think the lesson here is that COVID obviously is a really serious situation for our country and for folks in our country, but so are so many other things, right? And so sadly, overdose deaths are getting worse, and overdose is getting worse. And so we, along with what we're doing to address COVID, we also have to, continue to kind of prioritize interventions to address overdose. So that's kind of all that I was going to kind of talk about in terms of a data recap. Does anybody have any questions that either I or Travis maybe could answer? That's fine. We can. So now I'm just going to share a little bit about how the project is organized here locally. So again, we were given initial funding to hire staff, but because we're a wave 2 community and kind of are being treated as a control, we don't, we're in this really unique situation actually where we're not given any guidance from our funder. We essentially are being told to just enhance what's happening in our community, and that they'll be in touch with us in a year when it comes time for implementation. So we have a lot of freedom, which is really exciting. So when I first started in this role, the first thing I did was just started to talk to a lot of the community stakeholders. So I had those first few months, 60 one-on-one conversations. The vast majority of them happened over Zoom or in parks, just to get up to speed with what different community partners were doing around this issue, what their concerns were, and so on. In July, we formed a small advisory board that's been meeting every 2 weeks ever since. And in early 2021, we'll form a more formal steering committee made up of the key community leaders that need to be involved as we move towards implementation of the project. So some of the things that we've prioritized early on were implementation of OD-MAP, So OD-MAP is a system that other communities use. So Broome County, Onondaga County, a lot of communities nearby have already implemented the system. And what it does is it allows law enforcement and first responders to put information about overdoses into the centralized system. And the importance of that is that all the key stakeholders are aware of what's happening in terms of overdoses. And so they can see if there's certain hotspots in the community, they can see if there's a spike, if there, different trends, but then most important, they can deploy support services very quickly after something happens. And so not only is it about sharing and tracking data, but it's also then about getting that information in the hands of those that need it. So that, for example, a mayor or another key community leader can maybe release a public service announcement about something that we're seeing, or that a program like in Cortland County, the CODI program, which is a mobile treatment program, can go, to an address or go meet with an individual the day after an overdose happens to provide support either to that person or family members or neighbors that were impacted. And so I think we've made a lot of great progress in just a few months, where our local law enforcement have started sharing data. It's starting to get input into the system. There's just a few more kinks that we need to work out, but hopefully in early 2021, we'll be using this system. And a lot of community leaders are really excited about that. It's been really great to see the buy-in and see this come together pretty quickly. Another thing that we've prioritized is obviously the naloxone distribution. And we've already had community partners doing really great work. So our health department, now family counseling services, in different agencies that were definitely doing their part. But what we noticed is that there wasn't this coordinated effort to bring all the key people together and really see, okay, where are there gaps? Where are we maybe not ensuring that Narcan is getting in the hands of the people that need it the most? And one of the silver linings of COVID and this move to Zoom is that we were actually able to have representatives from OASIS, our state agency, join us for our meeting. So it was so neat to see directors of different community agencies, all sorts of folks, and then people from our state agencies here all troubleshooting, okay, what do we need to do? What creative things can we implement? And I will say that COVID has also forced us to be a lot more creative, and Jackie will speak in a few minutes about the work that she's been doing in terms of getting naloxone out there. We've been doing a lot of work around education and awareness, so we launched a website, healingcortland.org. A lot of educational content that we're thinking like how to best get it out there, you know, whether it's Facebook ads that we push out to community members, possibly doing, you know, virtual town halls and other things like that, really trying to figure out how best to engage with our community when we can't be physically close. Work around stigma reduction, because we know that stigma is still one of those big barriers that prevents somebody from seeking help when they do have a problem. And it also really hurts family members, you know, so family members who've either lost someone or has someone that's struggling, that shame and you know, hiding of what's going on because of the stigma that exists. Like I said, prescriber education. So we're thinking through how do we best engage with our pharmacists, with our local prescribers. Obviously, in the time of COVID is kind of taking priority. So, you know, trying to work through and troubleshoot how best to do that. We've been doing, thinking through a lot on how to promote harm reduction strategies. So naloxone is one type of harm reduction, but also things like syringe exchange, syringe disposal, fentanyl testing strips to ensure that people who are, you know, using drugs are aware if there is fentanyl in their drug. So exploring different things like that. And I will say, most importantly, Travis, we're so excited to have him joining our team, because right now what he's busy with is conducting this needs assessment to really understand what's happening here locally, so that when we actually go about developing kind of this action plan of, okay, these are the things we're going to do, that it's you know, it's really strategic and really figuring out what will make the most sense for our local community. Now I'm going to turn it over to Jackie to share a little bit about the amazing work that she's done, really supporting family and children's counseling services in getting naloxone out into the community.
Hi, everyone. I'm Jackie. It's nice to be here. So I have been working closely with a social worker from Family and Children's Counseling Service, Alex Mikowski. And so we've been working together and I've been supporting their work to help get Narcan out into the community. So she's also been involved in helping run the CODI program, which Sarah mentioned, and they do direct outreach after an overdose. So it could be anywhere from a couple days, the day after, maybe weeks after. They go to people's homes and neighboring like houses, and they do direct outreach, bringing Narcan and talking to them and trying to get it out into the community. And so I actually helped set up and run a Narcan pop-up event with Alex from FCS. And so it was technically a drive-through event. So we set up the van that's pictured in this, that's the CODI van. And so we set that up with tables and chairs, and we for 2 hours, we're getting Narcan out into the community. So we had, it was actually a gorgeous day. It was like 50 degrees out. So lots of people were like walking around. We were in a good location. So people were waiting to like get on the bus. And so we actually got a lot of people just like walking around. We would go up to them and ask them if they knew what Narcan was, if they were interested in taking a kit with them. And basically we just did like a brief training, 5 to 10-ish minutes, depending on what questions they had. And we train them also in like laws that protect them, how to recognize an overdose, and answering any questions they may have. So in that time span, we were able to get out 42 kits, which was awesome. And then also with Alex, we are starting to do these online Narcan training sessions. So Mondays at 3 and Wednesdays at noon, I believe we're doing Narcan training. So people can either call in or they can join by Zoom, and we'll train them how to use Narcan and answer what questions they may have, and then they can pick it up from FCS, or like we can mail it if that's needed. But yeah, so that's like essentially the work I'm doing with them, getting Narcan in the community.
Thanks, Jackie. And yeah, it's been really amazing to see Jackie jump into all this work, and we're really glad that she's able to support a partner and enhance the work that they've already been working on in the community. The pop-up event, it sounds like were a great success and hopefully are going to become a more regular thing. We're already talking about planning one for January. And I think, again, this is just an example of how COVID has kind of forced us to be a little bit more innovative and forced us to kind of go and meet people where they're at and try things that maybe we wouldn't have typically done. So we're really excited to see how some of these things pan out in 2021. Yeah, so like I mentioned earlier, we have a website. Part of the reason behind creating the website was also to kind of create this centralized hub of resources. What we realized where a lot of our partner agencies weren't necessarily able to keep their websites up to date, that if people were looking for services, it was challenging to find information about either different services or programs or resources that were available. And so over time, we're kind of building out the website. So for example, there's a tab about disposal, so you can learn about where to dispose of your prescription drugs. There's now new syringe disposal kiosks in Cortland County as well. So we have information about that kind of stuff, where you can access naloxone, that's on there. So over, like I said, over the course of the project, that'll get built out with like treatment resources, family support resources, and so on. And then a Facebook page where we're also pushing out different content. So that's where you can find us if you're interested. You know, we're just past kind of the 6-month mark of this project. We're just really excited to see where this goes in 2021 and excited to be working with more folks across the community. So please reach out if you're interested, and we're all happy to answer any questions that you have for us.
I have one. Sara, how are you? Nice to see you. Thank you for coming today. 2 things. The drop-offs for the needles, is that being used? Are people dropping off needles in there?
They are. We hadn't been receiving data, and within the past like 2 weeks, we just started getting the monthly reports. So people really started disposing, I believe, in August. And we get monthly reports. It's the Southern Tier AIDS program that actually collects them each month. And that's data that we're going to start sharing back out because I think people are interested. But yes, people definitely are using them. I don't know if Travis, you remember off the top of your head what were the numbers. I don't, but I'm more than happy to kind of share with you like a cumulative total.
It's not as important as the fact that they're actually using it. My other question was, so you say you're having these Narcan Zoom meetings twice a week. Are people attending those meetings?
A few. Not as much as we'd like. They just started and we haven't really been promoting them, right? So I think that's often a challenge, is that we make things available, but if people don't know that they're happening, then obviously you're not going to get great attendance. So that's part of what CACTC is trying to do. So we're in this project, right? So it's family counseling that's actually doing it, but Jackie is going to help support. And then we're working on marketing materials right now. And we've been able to piece together little grants to start, you know, actually promoting that more to the community. Jackie, I don't know if you want to speak to who's participated so far, but we've had a few people here and there. But again, not necessarily the numbers that we would like to see. And I think that's why we're trying different things like the pop-up events. We're talking about trying a drive-through event. We're trying different things and we'll see what works.
Thank you.
You counteract the Western states now legalizing heroin?
Yeah, so so what was the question though?
My question is, you've got some Western states that have passed some bills that are legalizing heroin now. And I was just curious, it looks like they're introducing drugs and say it's okay to use. You're trying to fight it. So I'm just saying it doesn't make much sense. So I was curious as to your thoughts.
Yeah, it gets into a really big debate, right? So I think,
I'm sorry.
I feel like Matt is a better person for this because Matt is good at answering.
So first of all, they didn't legalize heroin. They decriminalized heroin. That's a difference. So it's not legal. It's just decriminalized to possess heroin. It's not a legal drug. It's still a Schedule I drug. On a federal level, they did not legalize it, first of all. they decriminalize. And what they're doing is essentially diverting resources from the criminal justice system. So instead of imprisoning people for doing heroin or possessing it, they're gonna use those resources to get people into treatment and actually help them recover. And so it's Sarah said, it's a complicated thing, but just to clarify, they did not legalize it, they decriminalized it, and those resources are going to go into treatment and recovery resources. So essentially what they're doing is shifting the paradigm of treating drugs as a criminal justice problem to treating drugs as a public health problem. And that's very and that's really what we're seeing is a movement across the board, is that this is a public health problem. This is impacting life expectancy. This is impacting the health of communities. And so that's what their focus is on. I don't think that necessarily answers your question. I think it's complicated, as Sarah said. There's a lot of, we don't really know what the consequences of what they've done is going to be, and we won't know until the data plays out for a few years. That's just how our world works. So it's probably too early to say what the impact is going to be on treatment, prevention, recovery services until we know how those dollars are shifted, what the response actually looks like.
Matt?
I'm Sarah. Sarah?
Mhm.
I have a question for you. Who are the people that you want to particularly reach on the Zoom trainings?
Yeah, so I think we're thinking all sorts of people. So it could be anyone in the community who's interested in getting trained, but it can also be professionals who want to get trained for their job. So really anyone.
So here's a suggestion for you. Because a while back, Rotary, when we were meeting as a group, we had somebody come in and actually train us on using Narcan. And a lot of groups are now doing Zoom. But one possible idea that I thought of from that is that you might look at either professional groups that are meeting by Zoom, or I don't know, staff meetings maybe that are meeting by Zoom, looking at what groups are already available and are meeting by Zoom, and see if you can come in as a speaker and do the training that way.
Yeah, that's a great idea. And CCTC had a previous AmeriCorps member who did a lot of kind of outreach, and like, this was pre-COVID, pre-Zoom, but like would go to existing groups and locations. And I think that's what we hope to probably have Jackie help with a little bit, come, early 2021. And I love that idea. And I think you're right. I mean, everybody's meeting via Zoom. Why not kind of bring presentations to these existing groups and customize it to their needs, right? So I think it's important for everybody to be familiar with naloxone, right? But not necessarily everybody needs a kit if they don't feel like they need a kit. So we're really interested in kind of going out, at least sharing this basic information with folks so that they feel comfortable with the concept and know what to do if they ever, are in a situation where they would need to use this medication or know what it is. So thank you. Yeah, Jackie will have that be one of her responsibilities in the new year, is kind of following up with groups and offering that opportunity. What
risks are there to administering the drugs?
Yeah, so that's all part of the training. There really isn't. For the most part, it's benign if you don't have opioids in your system. So it just won't do anything. And so that's why now they really say just administer it. If there's any possible chance, if anybody's exhibiting symptoms of an overdose, so unconscious, then you just administer it. Now EMS and law enforcement, it's just standard practice to administer, because there really are there's a few situations where but we typically say there are no negative consequences. Hi, Frank.
What kind of data is there about the community use of these medications? Because even though the project's new, those kind of things have been in circulation for a while now, right? Is there data on the effectiveness of that kind of distribution?
Yeah, and that's part of what we kind of brought to the table when we were convening this group in August. Was we had Margaret Thone, who's the epidemiologist at CACTC, do a literature review. Okay, what does the research actually say is most effective? Like, what do we need to be doing? I mean, naloxone is highly effective in terms of reducing overdose death, and we know different strategies that are most effective. So Travis is like finalizing. We develop these like strategy reports at CACTC, which kind of outlines like what does the research say, what are the local conditions, and what do we need to do. And so we hope to be publishing our naloxone one probably in January, sharing that out with key community stakeholders. But in terms of naloxone, highly effective. I don't know, are you referencing other medications as well, Frank?
No, just that one.
Okay.
Thank you.
Hey, Sarah, I know we, Rotary contributed to a grant, and obviously with all the players, you've got lots of money there. How much is our little, 2 cents in terms of the size of the project?
I'm not sure that I understand exactly what you're asking.
What I'm asking is that Rotary has a grant for this opioid thing. And because, you've given us all kinds of folks that are involved with this thing, who else is funding this program?
So are you referencing the Healing Community Study or the other Rotary work that maybe Matt can speak to?
Probably the healingcortland.org. That's
Okay.
what I think we were doing.
Yeah. So I think what we're trying to do with this opioid work, we're trying to continue a lot of this high level work around addressing the opioid epidemic, and we're piecing together different funding streams, right? So previously we had a New York State OASIS grant. Now we have the Healing Community Study. But we're trying to create some level of continuity and ensure that these projects continue beyond grant funding, right? Because grant funding comes and goes. With the Healing Community Study, Matt can talk to the amount that the organization has.
I can try. It's always kind of a little up in the air. So because we are a wave 2 community, as Sarah said, we're not in full implementation yet. We're receiving about $200,000 a year to kind of the initial staffing phase of the project. Once we get into implementation, we will have more funding coming through Columbia University by way of, this is federal funding. And so something that Sarah, just to give you a kind of a sense of this project, this is the largest federal research study that has ever been conducted. The most amount of money, the largest study ever. The NIH has done. I think it's $89 million in total over 3 years across those 4 states. And so, we're one of those 67 communities. And so, on average, each community in New York State is going to get about $2 million, depending on size. And we don't have a clear sense of that, but it'll be somewhere, probably over $1 million that Cortland will end up receiving over the course of this grant.
Thank you. That puts it in perspective. Anybody else have questions?
Yeah, I have a question. What are the actual numbers per year or for this year of overdose deaths? Is it like 40 a year we have in Cortland County, or?
Travis, do you want to speak to this?
Yeah, absolutely. No, so the numbers aren't quite that high. We don't have data for 2020 yet, but say the fatal overdoses range anywhere from 5 to 15 per year. Our spike in 2017 was 14 reported fatal overdoses connected with some opioid. And in 2019, there were 8.
So how does that compare to adjacent counties?
So we're, on average, the Cortland County opioid death rate is higher than the New York State rate, New York State excluding New York City. We're amongst some of the highest in central New York. Onondaga also has a high death rate as well, but we're consistently higher than the New York State average.
Do we have any sense of why that is, Travis?
I mean, you know, this is what makes the opioid epidemic a wicked problem. It's a mixture of access to both illicit and prescription opioids, influxes of heroin and fentanyl, combined with gaps in continuum of care, be it individual and group counseling, as well as medication-assisted treatment within the region.
Thank you.
Do you have any idea how many deaths have been prevented with naloxone administration by police on duty and emergency squads and things?
Well, and so part of what I'm doing now is sorting through the fatal and non-fatal overdose numbers, and then connecting those with when naloxone was administered. And so we're seeing, and so unfortunately, there's not a set Cortland County data set that describes both of these. We have reports from the Cortland PD of when overdoses were reported and then whether Narcan was administered. And it seems to be quite effective in preventing fatal overdoses. I think as part of our needs assessment coming out in early 2021, we'll have a more comprehensive picture of the connections between the two.
Thank you.
Any other questions?
Yes,
I can't see who's speaking, but go ahead, whoever.
it's Dick Tupper. I guess you're making Narcan so readily available. Are you concerned that people that are doing these illicit drugs now feel safer to do it? So by knowing that they may not kill themselves, they may turn around and use more heroin or more, whatever they're using. So is that a possibility?
Sarah, do you mind if I answer this?
Yeah, go ahead.
So what you're referring to is actually called moral hazard, right? So the idea that you have some sort of protection against something bad that you're doing, so you might be more inclined to do it. There's been research into this, and I've read said research, and what I can tell you is that there might be some level of moral hazard happening, but the benefits far outweigh the consequences. That, you know, every time you administer Narcan, you're saving someone's life, and so regardless of what they do after that, you still save their life. And so if our goal is to reduce overdose deaths, Narcan is the way to do that. And so I think, sure, there might be a certain level of moral hazard involved with this, but increasing access to Narcan is not doing harm. It's only helping. And I'd be hard pressed to hear an argument otherwise.
When someone is in that state of addiction, they're not worried about safety. I'm speaking as a behavioral health person from that point. It's beyond that. They can be involved in behavior like this or other, similarly potentially fatal behavior, and know that they're doing it and not even want to do it and still be compelled to do it. So I think that's a spurious argument or concern.
Thank you, Frank.
Something we've been exploring too, or really thinking about, is making sure that we're actually making the most of that opportunity when there is an overdose. And I think that's part of what we're going to be able to do. We'll have the staffing and capacity and funding, hopefully, to really do that. Before the hospital turned to Guthrie, Matt had worked a lot with Dr. Furman, and they had started prescribing or offering Suboxone or buprenorphine to individuals who are at the ER after an overdose. So what can we do to, when there is that window of opportunity to at least offer and help connect someone to resources if they want that, right? Whatever those resources are, whether it's treatment, medication, you know, speaking with someone, a peer. And so that's definitely a gap that exists where we're not always taking advantage of those opportunities. I think we're starting to do it in certain areas with the CODI program, going and meeting someone after an overdose. We're working with the doctors in the ER to ensure that a person who presents at the ER after an overdose leaves with naloxone, but also, you know, is offered buprenorphine or is set up with an appointment at a treatment provider. So again, it's like a window of opportunity, and it's up to us as a community to support individuals and hopefully make the most of that so that someone, if they want to, can access services.
Matt, do you find any social economic group more susceptible to drugs than others?
I mean, that's complicated. It depends what community you're talking about. I think here, you know, I think generally the opioid crisis has not left any group untouched. You know, I think initially, you know, there was some reports coming out, you know, back when we started some of this work back in 2014, 2015, you might have heard that it was predominantly a white problem, right? That this was something that was impacting the white population. That is no longer true. I mean, there isn't any socioeconomic group, any demographic group that has not been impacted by the opioid crisis. It can impact anyone. There's multiple points of entry depending on what's happening to you. And so, no, I don't think there's one particular group that this is impact. You know, there might be health disparities that exist. So one group might be facing different consequences of the opioid crisis, and that's a different conversation. But in terms of who can be touched by the opioid crisis, I don't think there's a specific group that is more susceptible than others. The consequences, that gets into some of that criminal justice conversation, but the entry points, there really isn't a specific group that's more susceptible than others.
Anybody else? Okay. Sarah, do you want to give the recording back to Doug?